LPR stands for laryngopharyngeal reflux disease, so you can certainly understand why we just use the acronym LPR. And this is where reflux coming from the stomach is going all the way up the esophagus and into the throat. So it's going into the pharynx. This is what we call this area. Now, as discussed earlier, this can cause significant damage and changes in the throat, and that leads to lots of complications and problems for patients. So this can be issues with actual damage to the vocal cords, causing hoarseness or changes in voice, chronic cough, ear infections, a sensation that there's just something getting stuck or constantly in my throat from inflammation. And really this is a big problem that again is often not diagnosed and or treated properly. So what we find is that a lot of patients with LPR don't have any symptoms of heartburn. So when they go in to their doctor or even a specialist, they say, well, I've got all this stuff up here, but they naturally ask, well, do you have heartburn? And the answer is no. They usually move on to other things and begin to ignore reflux as a cause of their symptoms and problems. So it's in some ways called silent reflux for that reason. Patients often don't have the classic symptoms, but they do have symptoms up here. So we want to differentiate those two diseases. In fact, it's really called LPRD disease because it is, again, a true disease that can lead to significant complications down the road. As a side note, again, it's poorly treated with the medications that we have on the market today. So Zantac or Pepcid, these simply don't do a very good job with LPR. And the reason is that the pathophysiology of the disease, which is kind of a fancy term for the reason why you're having problems, is different than classic reflux. And so while there are some barriers in the esophagus to protect against acid, there really are none up here. And what we find is that refluxed enzymes that are naturally in our stomach to help digest food, especially proteins, can come up, embed themselves in the lining of your throat, and then even a small amount of acid can activate those enzymes, causing all of these problems. Significant damage where you might not have any problems down in your stomach. Finally, bile that is also in all reflux from the stomach causes significant damage again in an unprotected area. So this is a huge problem, and it's even a huge problem for surgeons. So we know that the Nissen fundoplication as well as the LINX procedure do a very good job of controlling these symptoms, but it's not perfect. Not all patients get completely better because even a tiny amount of acid and enzymes up there can cause a significant problem. But we do know that the truly only effective treatment for LPRD is the surgical option.